I'm Brigadier General Dave Doyle, Commanding General here at JRTC in Fort Polk, and I'm joined by Command Sergeant Major Mike Henry, our Installation Command Sergeant Major. Last week, during our Facebook Live session, we provided you an update on the installation's COVID posture. At the time, JRTC in Fort Polk remained at Health Protection Condition Alpha, and masks were only required in indoor settings for those individuals who were not fully vaccinated. We also told you during that session that if we received written orders from our higher headquarters that changed our policies here at JRTC in Fort Polk, we would keep you informed. Today, 3 August, our headquarters, U.S. Forces Command, published guidance regarding mask wearing and COVID mitigation. The guidance specifically states that in areas of increased community transmission, all personnel, whether vaccinated or unvaccinated, are required to wear a mask in all indoor settings. The local transmission rates at JRTC and Fort Polk have identified us as an area of increased community transmission. This is a change from just last week. So here's what we're going to do. Effective August 4th at 6:30 a.m., we will reinstate mask wearing at JRTC and Fort Polk while in indoor settings for all personnel, whether vaccinated or unvaccinated. In addition, if you are not fully vaccinated, you should continue to practice physical distancing. We will also change our health protection condition to Bravo. This means we will be adjusting specific services on the post to enhance social distancing and to protect the force. Sergeant Major?
Sir, while we move to Health Protection Condition Bravo and make some adjustments to certain services, there are some things that will not change. There will be no change to our outdoor activities. The occupancy in our child development centers will remain the same, and no change to our physical readiness training or our report to duty status. Vaccination still remains the best way to counter the virus and protect our people, and return to a sense of normalcy here at JRTC in Fort Polk. BJAC will continue to provide vaccination for all eligible people. Our medical experts remain ready to provide the facts to any and who are still hesitant to receive the vaccine. Sir?
This is the right thing to do to protect the force and our critical mission for the Army. To ensure compliance with these guidelines, I am directing commanders to review the directives found in the previously published December 2020 General Order Number 1. My number one priority is taking care of our people, and that means we have the responsibility of ensuring the health and safety of personnel at JRTC and Fort Polk, each and every one of you and your families. Now the Chief Nurse from Bain-Jones Army Community Hospital, Colonel Mike Schmaniak, will provide you with an update on some of the changes to the operating procedures at BJAC that are related to COVID-19. He will be joined by our Garrison Commander, Colonel Sam Smith, to discuss the changes you will see on the installation.
Thank you, sir. Hello, I'm Colonel Michael Schmaniak, Chief Nurse of Bain-Jones Army Community Hospital. At BJAC, as with all military treatment facilities, we have continued to require masks for all of our patients and staff. It is very important to Readiness that we remain vigilant. Hospitals around the state are filling up with COVID-19 patients, and we must protect our healthcare providers and you to mitigate the spread of COVID-19. Effective Thursday, August 5th, we will require all non-emergency patients to enter through Entrance B during our normal operational hours, Monday through Friday, from 6:30 a.m. to 5:30 p.m. That is the entrance adjacent to the lab and pharmacy. Upon arrival, you will be screened and have your temperature taken. If you are presenting signs or symptoms of COVID-19, you will be redirected for testing. If you have been in contact with someone who is COVID-19 positive, please do not come to BJAC. First call 337-531-3011 for a telephone consultation with your provider and quarantine for 14 days. If you have symptoms of COVID-19, a list of local testing sites can be found at the Louisiana Department of Health website at ldh.la.gov/coronavirus. Our employees and staff will also be screened daily and have been advised to self-monitor before reporting to work each day. This change will also affect our inpatient visitor policy. Until further notice, we will return to our one visitor per patient policy. This will primarily affect labor and delivery and our mixed medical surgical ward. What we have learned is that the Delta variant of COVID-19 is more transmittable and causes more severity of illnesses, resulting in a higher hospitalization rate. Unvaccinated and partially vaccinated individuals are at higher risk. We have plenty of vaccine appointments available at BJAC. Soldiers, family, members, and TRICARE beneficiaries can schedule a vaccination appointment by calling 531-3011 or through the patient portal at TRICAREonline.com. DoD employees and contractors who are non-beneficiaries can get vaccinated through our public health department by contacting the Occupational Health Clinic at 531-6131 or 531-2706. Colonel Smith.
Thanks. Greetings. I'm Colonel Sam Smith, your Garrison Commander. Today, going to briefly discuss how we're going to respond as an installation to the additional mask and COVID-19 requirements. Over the past week, the number of positive COVID cases across the nation has increased by 25%. The number of deaths across the nation has increased by 15%. Currently, Louisiana is number 1 in the country for the number of new COVID-19 cases. We are reviewing our installation services to assess occupancy rates for indoor services like gyms, CDCs, commissary, PX, and the Forge. We must maintain our vigilance and follow General Order Number 1, and we must do what is right to keep our installation and our families safe from the virus so we can accomplish the mission. The best thing you can do to protect yourselves and others from the virus is to get vaccinated. We have shown, and the science has shown, that those that are vaccinated are less at risk to become severely ill or hospitalized. Let's all do the right thing to protect our installation, our community, our families, and our children. Thank you.